So I'm often asked, what's the difference between dry needling and acupuncture? All acupuncturists do dry needling as one of the techniques that we use. But most people that refer to dry needling and use dry needling are other healthcare professionals that use it as an add-on modality to the treatments that they already use, such as physiotherapists, doctors, physical therapists, anybody that does kind of manipulation type of therapy. And they do a short course in needling, and they needle into trigger points to release the muscle and the fascia. And that is what they use it as an add-on to the treatment that they're already doing. When you come to see somebody as an acupuncturist, it's a really different approach. And the reason for that, well, for starters, we do 400 hours of training compared to someone that does maybe between 50 and 100 hours. And even though it's recommended by the WHO that doctors do 200 hours of training in needling, specifically acupuncture points, there's absolutely no competency exam at all. In acupuncture, you're assessed all the time. You're assessed with monthly assessments, you're assessed with yearly assessments, and you're assessed by obviously the end of your training when you do your exams. And we do up to 3,600 hours of training. So whilst 400 is the minimum, we actually do an awful lot more. So when I was training, we were needling every single weekend, right from weekend number one. And putting a needle in somebody is actually an invasive treatment. So you need to know what you're doing. You need to be able to safely look after the person that's in front of you. You need to be used to working with needles. You need to be not giving anybody any extra injuries that they haven't come in the door with. We don't just needle into trigger points, although we do use trigger points as part of the needling, because of course, where did dry needling come from? It comes from acupuncture. And what does the word acupuncture mean? The first part of the word means needle, and the second part of it's Latin, so I'm not going to bother translating. And the second part means puncture, to puncture the skin. And anytime you're doing something that's invasive, you're putting somebody at risk for infection. And then depending on the person that's coming to you and their medical history, obviously you need to be very careful. There will be certain people that you will not put needles into because it's unsafe for that person to have that treatment. Now, I don't think that you're going to learn all of that by doing up to 50 hours without any assessment, 50 hours of training. And that is theory and needling. And there's no assessment at the end of it. There's no follow-up training. There's no continuous professional education because it's a different speciality. It's like this is an add-on to help the treatment that you're already doing. But in acupuncture, it's one of the major tools that or Chinese medicine, sorry, it's one of the major tools that we use. We also use, because I'm a herbalist, I also use herbs for people. So when I'm treating pain, there are different types of herbs that I do, and those are specific to the person that's in front of me. And then my specialist training is in pulse diagnosis. So it really depends on what the cause of the pain is for that person. Pain is caused in the body by lots of different things. It can be an acute injury. It can be a chronic medical condition. It can be, it's very much related actually to mental, emotional issues, and as in the degree of pain that people experience. So what do I mean by that? Oftentimes people will have MRI scans done to see if there's an injury there. Obviously the doctors are doing this, and to see what type of treatment will be used. And what they've discovered by doing these scans is that what might look really bad on a scan, the person sitting in front of the doctor may not perceive that as really, really painful. But then somebody else may have a very, very tiny injury or even almost difficult to see it on the scan, injury or inflammation. And the person that's sitting in front of the doctor is in excruciating pain. So whilst I suppose that's what I see the advantage of acupuncture being, because or Chinese herbs actually, because we can treat the mental, emotional aspects at the same time. The first needles that I put into anybody are calming needles, and any needle that's calming is anti-inflammatory, and of course that's going to reduce down pain. So the more relaxed you are, the better the results you're going to get from the treatment that you're having. The other thing that I do, because I do distal needling, which means I always needle away from an injury. And that means I don't cause any further trauma to the injury. I never, ever needle into an area of inflammation. There's so many other different options. The other positive, I guess, about acupuncture when you're having needling done for pain is that if you have, for example, a limb that can't be used. So if, for example, you've had some surgery, you've had cancer and you've had a lumpectomy, or you've had a mastectomy, then often they will remove one of the lymph glands. And if any of these lymph glands are removed, this can affect the flow of lymph in the body. And that can cause lymphedema, which is just affect with the swelling of the arm. And it's recommended that you don't needle into that area. So if your pain is on that side and you go to somebody who's a dry needling specialist, as some people call themselves, and they needle into that area, they are putting you at risk. With acupuncture, there are lots and lots of different options in the body. So I see acupuncture is hugely different. The term dry needling as well, all it means is that we use a filiform needle or a filoform needle, whatever way you want to pronounce it, which is a very, very thin needle. And it's different to a hypodermic needle where fluid is injected. There's something injected into the body. And an acupuncture needle, there's no empty space in the middle of the needle, which is why they're so fine. And it's why they're not really that painful, even though the perception is because you're having a needle put into your body that it's automatically going to be painful. And it really isn't. It is briefly sore in certain points for sure. And then depending on the type of injury you have, you need more or less needles, and depending on how long you've had the pain as well. So that's it. I hope that gives you a little bit of clarity and that I haven't gone into too much detail there. But please put your questions underneath the video and I'll happily answer them. Thanks a million, guys.